In eastern Ukraine, people are trying to survive two wars, a 7-year-long conflict between Ukrainian forces and Russian-backed separatists, and Covid-19.
We constantly feel the lack of oxygen. This is difficult for us. There is a lack of oxygen in the whole region.
In April, an estimated 150,000 Russian troops amassed in the disputed territory of Crimea and on the border with Ukraine. They pulled back after weeks of military drills, but those living in the conflict zone are in constant fear of escalation.
It's like being in Chernobyl here. Nobody needs us.
In Stanitsa Luhanska, in the government-controlled areas, the effects of the pandemic are strikingly visible. This town is home to the only pedestrian crossing point along the so-called line of contact, an almost 500-kilometer border between the two fronts. Freedom of movement has been doubly impacted here, first by the war and now by COVID.
Before, there were up to 15,000 people, and sometimes up to 17,000 who crossed this checkpoint every day. Now, the numbers crossing in both directions are lower than 2,000.
This is what Stanitsa Luhanska was like before the pandemic. People were able to move between the two sides to get their pensions, see their families, sort out legal problems. Many would even do so on a daily basis to sell their produce. That business has been wiped out. On both sides, people are poorer and more isolated.
Not everyone has money to pay for COVID tests. That's why people don't cross without an urgent need. We came from Odessa to see our relatives. Before we did it twice a year, now it's the first time in a year and a half.
We head to Peredilske, just 5 kilometers away from the line of contact, to find out what the COVID frontline looks like. This medical center is the kind of facility available to patients living in the most dangerous areas of eastern Ukraine. The head nurse here says she's doing the job of 10.
I'm responsible for 1,200 people living in 2 villages. There is a lack of healthcare staff, and with the pandemic, we feel this absence even more. Doctors are afraid to go to the villages.
Fighting the third wave of COVID here is a high-risk job. No COVID tests are available in centers like this one, and most of the medical staff have already been infected.
Because of COVID and the current situation, people are in panic mode. In the red zones, lots of people got infected everywhere. People don't even want to go to the doctor. They're even afraid to go to the market. I don't go to places where there is a lot of people and it's crowded. I just go out to buy bread and that's it. It's because of our age. I'm 80. My husband is 85. We're afraid.
According to Medicos del Mundo, the already weakened Ukrainian healthcare system requires around 40% more staff to fight the pandemic. This EU-backed NGO says that most urgent needs are not being met.
As a consequence of conflict, the local health system is lacking the emergency care unit for the infectious diseases, and those units that were organized recently do not match the health and sanitary requirements.
Even specialist COVID-19 hospitals further away from the line of contact are struggling to cope. The infectious disease hospital in Konstantinivka increased its capacity, but it still needs more beds and more staff.
Now we have 90 to 100 patients, and most of them are in serious conditions. I am asking the staff to work extra hours, and of course they've been paid for this, but it's not enough. People are definitely tired.
Oxygen supplies are another huge problem for hospitals in the whole Donetsk region.
To have enough, we need about 70 to 80 bottles per day, but we can only afford 45 to 50.
The number of COVID-19 cases are decreasing in Luhansk and Donetsk, the two regions directly affected by the conflict. But the emergency is far from over.
Maybe there is a bit of a decrease in the number of people infected, but we have observed an increase in the number of patients in a critical state. This means the intensive care unit is full, and the epidemic is not stopping.
The isolation and the remoteness of some areas has helped to contain the virus. But difficult living conditions caused by the conflict mean the risk of COVID clusters is a reality. We are in Opitny, less than a kilometer away from the line of contact. The scars of the conflict are everywhere. Water and gas here have been cut off for almost 7 years. The village of Opitny is COVID-free. Here, nobody comes and goes without authorization from the army. Residents are fully dependent on the EU-backed NGO People in Need for water that they receive every 2 weeks. For the village's 40 residents, it would be extremely difficult to tackle the pandemic without access to clean water and proper sanitation.
Given the fact that almost all our residents are of retirement age, if COVID visits us, I think we would have huge problems. We really do not have medical care. Doctors do not come to us.
Isolation hasn't spared many other villages in conflict-affected areas. Ivan was among some of the residents infected in Vodiane. He was taken to a specialist hospital in February and is now recovering. He is one of the lucky ones.
COVID is like a second war. It's frightening as well. It seems like everything's fine, and then, out of thin air, someone dies. One moment you're here, and the next, you're gone.
Ivan and his wife think the vaccine will save their village, despite Ukraine's slow vaccination campaign.
Vaccination is taking its time here. Yesterday, the doctor came, gave jabs to only one family, and then left.
The COVAX initiative is expected to supply 20% of the country's vaccine needs by the end of the year. With this global initiative aiming to make vaccines accessible to all, relief is on its way. Vaccines are the weapon that will help win one war in Ukraine.